Hi everyone, my name is Cindy Toner. I'm a chiropractor, and this is my son David, and today we're going to go over some spinal stretches. So one of the things that we as chiropractors, my husband is Jason Platsky, in our clinic, what we notice a lot is that a lot of our patients are stuck in a position of sitting all day, and we also have what's been created as text neck with this generation, so people are often looking down, and what this does with our posture is that it wreaks havoc on the thoracic portion of our spine. And so a lot of people, what we're finding, have limited extension in the thoracic spine, and when you have limited extension in that area of your spine, then it can create a lot of neck pain and even some lower back pain because of the compensation for lack of movement. So what we're going to go over today are some stretches that you can do either on a daily basis or 3 to 4 times a week that will help you roll out some of the stress and tension that can accumulate in your spine. So just like we floss our teeth and brush our teeth every day, yet every year our teeth get worse, not necessarily better. We have to halt the degenerative changes that go on in our spine by doing things that can prevent abnormal movement. So David's going to go over, we have 3 stretches. This is the first one that I want you to do. Now this is a roller that I recommend. We sell them at our clinic now. It's a long roller. This one is a smaller roller, which we used to have. It's less convenient because you can't lay on your spine without using a pillow, so it makes it a little bit more difficult. But if this is all you have right now, you can get away with it with a few little tiny adjustments. So if you haven't bought one, the longer one is the one that I would recommend. And David is going to show you how to do the first rolling one. So this one right here, you're going to lay on your back. So your feet are going to go over there. Perfect. So bend your knees. Excellent. Hold your head. And so what David is going to do is going to lift up his bum. There we go. And that's it. You're going to roll it and keep your head back. That's it. Okay, and then roll back like this, not too far. Okay, stop, not too far down the spine, and then extend your head back. That's it, David. There we go. I don't know if everybody can see that. But what you would do with this one is make sure that your hips are lifted off the ground, and what David is going to do is just go down to where the rib cage ends, so like in that thoracic area, and you're going to go up as far as where, the bottom of the neck. And you're just going to roll this out 5 or 6 times. Now, on your first time, if you do more than that, you may be sore on the next day. So, David, this is good. Now, what you want to avoid doing is being in the position of flexion when you're doing it. You actually want to reverse the position that you're in all day by being slightly in extension. Okay, so that's the first one. Now, the next one that you're going to do, David, is that you're going to lay your whole body on your, you're going to go on your back. So, have a seat here. Oopsie, there we go. And actually slide down a little bit so we can do the other one. Down, slide down, down. There we go. Okay, now you're going to lay your whole body down. Perfect. And put your head down. Excellent. And now you're going to bring your arms out. There we go. Now David is going to hold this position here for about a minute. There we go. David has pretty good flexibility. Some people can't even touch the ground when they're doing this one. So if your arms are off the ground, in that 90-degree position, if your arms are off the ground, you can put like a little yoga pad or a towel so that it supports them. But David is going to feel a big stretch in the pec muscles in the front of his chest. Okay, so you can do that for a minute, maybe even 2 minutes will feel good at the end of a work day. Okay, now David, the other one is we're going to do the extension of your arms. So remember, put your arms straight and bring it all the way back up behind your ear. That's it. So thumb down. David has really good motion in here. This is going to help the upper part of your spine. Okay, now you hold it there for a second or two, and then you go the other one. That's it. Thumb down. Sometimes you'll find that one side is easier to do than the other. Excellent. Keep doing it. You're going to do 5 times on each side. So you would start with that, and then if that feels easy, you can go up to 10 on each side. You'll get the gist of it once you start doing, but start slow and make sure that you do it often enough that you're getting some preventative changes in the spine. And on this one, you want to make sure that you keep your back flat on the roller. So don't cheat like I do when I arch my back. You just want to keep your back flat. Okay. Hope this is helpful. It should only take you a few minutes a day to do, but it's really good in helping to prevent some degenerative changes in your spine. Thank you for listening.